Hello, my name is Dr. Steele. Today I want to talk to you about something that we need to keep in mind. There's a correlation between heart disease and gum disease, or gum disease and heart disease. There's a little controversy if it's a direct effect or indirect effect, but the bottom line is this. Any type of inflammation can lead to, especially inside our vessels, to create a scenario where those vessels become damaged. And that damage inside those walls of those vessels can precipitate a heart attack or a brain attack, also known as stroke. So, gum disease, the thinking is if you have inflammation, that inflammation releases certain cytokines, certain substances that make it more likely for you to have a blood clot, also known as thrombosis in medicine. But also remember that gum disease is something that happens to a lot of patients because gums do not have a lot of pain receptors. And I think the reason for that is because back in the day, when our ancestors didn't have a dentist back in the day. So through time, the people that have a lot of gum problems and pain, they couldn't survive because they couldn't eat. Versus the people that have very few pain receptors in their gums survived. That's the so-called survival of the fittest. So a tooth that is rotten hurts, but the gums do not hurt, even though I've seen patients with a lot of gum disease, a lot of inflammation. The idea then is, even though it's painless, it is important for you to go to the dentist every 6 months for not only a checkup, for prophylaxis, they call it, a cleaning of your teeth. Now remember, the tooth that you see is the tip of the iceberg. You still have 2/3 of the tooth underneath that gum. That even though you try, even though you do everything right, you don't have the instruments to clean that part of the tooth or teeth. So reminder, it's important just to get them clean every 6 months, because not only does it could affect your heart and your brain by having a heart attack or stroke, but also because if you have inflammation, even though it's clinical, you don't have any pain, it releases those substances. And also, especially if you have diabetes, it makes it more challenging to control your diabetes when you have any type of infection, any type of inflammation. So that's my talk for today. Remember to see your dentist. Remember to brush your teeth, floss your teeth, and use a mouthwash every single day.